use of weight loss drugs like Ozempic and Wegovy has boomed in recent years, with the sales of the top drugs reaching $15 billion in 2023. Now, it's also important to note that off-brand compounded versions of the medications are also growing fast. But with the popularity of these drugs consuming the conversation, it is also important to explore all options for weight management. So joining us this morning to talk about the various weight loss solutions available in South Carolina is Dr. Marc Antonetti with Lexington Medical Center, South Carolina Obesity Surgery Center. Good morning, Dr. Marc.
Good morning. Thanks for having me.
Absolutely. So first things first, I want to talk about this. So according to the CDC, sustained weight loss of just 5 to 10% can improve your health and well-being. Experts say it can reduce the risk of heart disease, diabetes, and other chronic conditions. So the conversation, the way I want to start this is, for a lot of folks, losing weight is a great thing, but it's important to note that it's not one size fit all.
No, it really isn't. When considering weight loss options, it's really important to talk to your healthcare provider to figure out which of the options is going to be best for you, really. Because there are very different weight loss options out there. Obviously, the weight loss medications have increased in popularity, and we can talk about some of the pros and cons of that.
Absolutely. Let's go ahead and dive right into that. Everybody's talking about Wegovy, Ozempic, Zepbound, those compounded versions. What are some of the risks and benefits of those medications?
So weight loss medications have been around for a long time. There's been a recent increase in popularity with a new generation of drugs that you mentioned, Ozempic, Wegovy, Zepbound. These drugs were originally designed to treat diabetes, and they had the side effect of producing weight loss. People can expect to lose significant weight, 5 to 7% of their weight. As you mentioned, that can significantly improve health, and the weight loss does occur fairly quickly. What people have to keep in mind is these drugs were designed to be taken for life. So once people stop taking the drugs, they tend to regain the weight. These drugs aren't for everybody. You can't take these drugs, for instance, if you are trying to become pregnant, if you are pregnant, or if you're breastfeeding. You have to discontinue those if you're trying to become pregnant. A lot of people can't tolerate some of the side effects, which include nausea or vomiting or GI upset. There have been significant complications and conditions associated with the weight loss medications, which include increased risk for some thyroid cancers, inflammation of the gallbladder or pancreas, just to name a few.
So definitely something that you want to talk with your health professional about. I want to spend some time also highlighting the fact that there are other weight loss options available for South Carolinians. Can you speak to some of those?
Sure. So losing weight can be difficult. The body tends to have a set point and wants to return to that set point. So people will initially experience some success with weight loss, often to regain weight. So it's important to take into account the individual and what their long-term goals and to find a long-term solution. So all weight loss options basically include some form of behavior modification, including improved eating habits and increased activity. So the options out there include some virtual or online support programs. There are a variety of different diets. There are weight loss medications as well as weight loss surgeries to affect weight.
Absolutely. And the biggest thing, the biggest takeaway, talk to your healthcare provider. They're going to be really able to help guide that conversation so you can find the best option for you. Dr. Marc Antonetti, thank you so much for shedding light on a topic that is really consuming so many people's conversation.
Thanks for having me.
Absolutely. All right, my friends, still ahead on News 19 this morning.